Welcome, guys. We're here talking today about what we do. Today's a very unique day. It's my father's birthday, Alberto Agosto Jimenez, an immigrant from Colombia who gave me my knowledge, my amazing father. So happy birthday, Dad. What we're going to be talking today is we're going to be talking about what we do. We have a group of wonderful individuals here. We have 5 individuals. We have a whole lot more people in the background. So what we're doing today is we're beginning a process of notifying ourselves of a change, okay, that is actually going on. We're going to be talking about nutrition, wellness, exercise, and what we do in the office and how we do a little bit different techniques within the office, and how we compare and contrast to other services, and let people understand what we do as we change. So today we're in a new podcast. We actually left the Push Fitness Center, which is now going to be another big, amazing thing. So as they do the construction, we moved our podcast here. So you're going to notice that we're going to be communicating from this particular podcast, but we're still connected to our Push counterparts and our Push Fitness Centers and Daniel Alvarado. And we'll be making that happen too as it starts coming up. So today we're going to be talking about nutrition. I have Ana Rodríguez Arciniega here. So say hello there. We have Faith Arciniega. Okay. We have Adriana Caceres, and we have Amparo as a massage therapist there. So we're going to be talking about different things. So each one of us has different things. So I'm going to first start out with a little bit of the unique things that we're doing in our office, such as the types of treatments that we do. We deal with a lot of inflammation, a lot of injuries, a lot of traumas, a lot of soft tissue injuries, but you can't get away from soft tissue injuries without discussing inflammation. So what at the basis of inflammation, what we do is we associate, collaborate, find out the coincidence of inflammation to injuries, and we actually deal with the true causations of inflammation and come up with treatment protocols and healthcare plans that actually affect people and in their disorders. So a lot of people come to us as a, let's say, a back injury or a neck injury after, let's say, a motor vehicle accident, a car accident, a work-related accident, but they may also have subclinical issues of inflammation that are just looming and then just aggravate the direct trauma that's actually going on. So what we're going to do is we're going to introduce our team here one at a time so we can see what's going on. And we're going to start with Ana Rodríguez. Ana, how are you doing?
Hi, I'm doing fine. How are you doing?
Good. Can you hear us okay over there?
Yes, I can hear you fine.
Excellent. Tell us a little bit about what you do when we actually, because you work hand in hand with us all here, and you are our virtual eye in the sky for nutrition at this point. But the nutrition that you deal with works a little bit with functional medicine. Tell us a little bit about what it is you do and how we integrate that particular type of practice in our office.
Okay, so I am the head nutritionist, and basically what I do is that I take care of the nutritional assessment. But as you said before, we look for the root causes, and this allows us to create a more integral treatment plan for our patients, so that is actually focusing a little bit more on finding what is the root cause of inflammation, because it is related to injuries, to oxidative stress, and to maybe a delay on the recovery part of our patients. So this is what we are trying to do to get like a fast track recovering for our patients through nutrition, because it has to do with all of that.
Yes. And then? Don't worry.
Okay. I'm here.
Don't worry. It's our technology. Don't worry about it. Just keep on going. Keep on telling me. We'll figure it out as we go.
So, what we start doing this is, first of all, I try to focus on what is going on with my patient physically. And that has a lot to do with the body composition of my patient. So I find that is like the principle, not the principle, but the first step to do it that way. So we try to integrate this body composition analysis with the InBody 770 machine that we use. And that way we can correlate all the body composition, either fat mass percentage or BMI or muscle mass or lean body mass that our patient has, and try to correlate it with injuries or try to correlate it with inflammation. And it is very often or all of the times that we find a direct correlation with inflammation. or with the side of injury, specifically talking about the water, the intracellular water and the extracellular water part of it. So that is one of the most interesting parts, or how I like to start with my patients. But the thing about nutritional assessment is that even if it's like separated into different parts, it kind of overlaps within each other. And that is like the thing that it has in common with functional medicine, functional nutrition, and trying to treat your patient as a holistic, like a whole person, and try to integrate the nutritional part of it, the fast track recovery of an injury, the massage therapist, and of course, all the wellness part of the recovery that has to do with our health coaches. So mostly what I think that I do right here is that I am part of a team that integrates like a holistic care plan of for patients.
Well said. Well said. That is very, very good. I got to tell you, there is no separating inflammation, nutrition, and injuries. There's no way. So as we deal with it, we can learn about. It's almost like saying exercising and not talking nutrition. We have to deal with nutritional components. Now, specifically, now that we talk about exercise, Adriana here, she's our specialist and are also expert on exercise physiology. She works with nutrition. She has a large experience of working with clients online and video, as well as in your home. So she actually gets in there and exercises with you as she does her thing. Adriana, tell us a little bit about your experience and what you do and what you offer this particular dynamics with our team here.
Yes, sure. Well, my name is Adriana Caceres, and I'm here. I'm your health coach, fitness trainer, and of course, exercise specialist. And as Ana was saying, nutrition and exercise go hand in hand. Definitely, nutrition is the base, but the exercise gives you the mobility and gives you that range of mobility that you need to live a proper and well life until, when you age. So definitely it's the base for a lot of recovery for injuries. The stretching is super important, and we use that a lot here to stretch our patients and make them do their own small stretching so they can grow their range of mobility and have a better life in their daily lives, their daily style. Right now, I work on the online a lot. So since COVID started, we started working on online with our patients and clients, and it's different, but at the same time, it's super fun. The difference between going to a in-person exercise session and doing an online session is that you don't have. We always hear excuses. You're like, I can't make it. I don't have the time. I'm too busy. I know that I'm in pain, but it's too far. So the online cuts all those excuses. I mean, you're doing that from the comfort of your home. You are just opening your TV or your computer or your laptop or your tablet and connecting to a session. It's on your time. So that helps a lot. Second excuse we always hear if we are parents, it's who watches our kids? What am I going to do? There's no daycare. And this is just as the same thing. It's at your home. So you can even be involving your family into this new lifestyle that is super important. Normally, when we have somebody who's overweight, it is a family. It's the household, because of course it's the same poor nutrition that they have or bad nutrition that they have and the same habits. So starting with the workouts online help you realize, or your household realize, that it's a group thing. It's a whole lifestyle, and you want to be the role model for your kids. You always want the best for your kids. So you want to be the role model for them. Normally they will, if you're overweight or have a little extra pounds on, your kids normally will have the same habits, and of course will tend to be with the same kind of overweight that you have. So this helps them see a life change experience and get involved in this new experience.
Now that you mention that, it's very important to be the change that you expect in the world. I think that's Gandhi or something that says something like that. Be the change you want to see. Right. So the thing is that when you go purchase foods or you exercise in front of your kids and they see what you do, this is who they will become. And what do we want for our children? We want the best. Our legacy is our family sometimes, or our friends. And when you have family there watching you, they learn, they watch, and they appreciate mom, wiggling around living room, and deal with it. Everyone's got memories of their parents exercising or doing something. And then, what happens later on, we end up becoming our parents, right? So if we have good habits, we eventually will become habits. I have become my father. And it's the truth. The reality is that my son, I listen to him. He doesn't realize it, but he says everything I used to say. So it's a continuous change. So if you got nutrition and exercise, which seems to be one of the greatest kind of collaborative, associative, and the treatment protocols, you can't separate exercise from recovery. So when you Parkinson's, exercise; Alzheimer's, exercise; diabetes, exercise; brain disorder, exercise; health issues. Exercise is such an important component of fitness that by not doing it and not being part of it, you're going to minimize the ability to return to optimal configuration. Now, whether you like it or not, exercise and mobility is one of the most important key factors. I realize that when you start working on so many patients over the years, you start seeing the intent of God, right? So the intent of God is mobility, and he gives you tons of joints. I mean, why would he give you so many joints? So we can wiggle, okay, to move, right? So using that and integrating the brain and the function of the brain with your body moving and pumping blood, it does heal a lot of issues, and should be part of most treatment protocols. Even if exercise doesn't look like, let's say, a Zumba class, maybe it's just wiggling around in a chair or doing certain things. We can do it for a lot of people. People think that I've seen from 9-month, literally about to have a baby, women doing CrossFit, and the baby is born fine. The body's designed to handle certain things, to elderly people, 100 years old, exercising. So, and children, they love to exercise. So it's an important component. So yes, that is what you do, Adriana. And we basically integrate that in the office, and we look for minimizing the excuses to be able to do that. So that's very important. So do you do also nutrition, Adriana, a little bit?
Yes, I do. I'm a nutrition consultant. So I do help a lot with that part. I think that, as I said, it goes hand in hand. Definitely to have a higher health span. You want to have a healthy habit. So one thing is lifespan and one thing is health span. Lifespan is the amount of years we're going to live, and then eventually we'll die. And then our health span is how we want to live them. Are we going to live them healthy? Our last 10 years, are we going to be able to walk? Are we going to be able to sit? Are we going to be able to get out of a bathtub? So that's what you want to have. And that's what we don't think about when we say, oh, you know what? I know what I'm doing, and I really don't think exercising is for me. Everybody has a fitness level. Everybody has a way. And the trick for this is just to find what you want to do. And what we do here is a lot of that. Build up people safe from injuries, and and prolong their life, and prolong what they how they live their life, their daily activities.
You know what? It's excellent, that approach. Now we also have a young lady, is Amparo, right? Did I say it right? Amparo, yes. Amparo. Got issues with my speech. So for Amparo, she does her massage, and what she does is she works on individuals with deep level of knowledge of fitness. Now she comes to us with a huge amount of personal experience in working with people and the desire for health care in her. So I'd like her to tell us, welcome, and then tell us a little bit about what you do in terms of the massage component within this group.
Thank you. Being here, a part of this family, this community of servers, is because that's what we do. We serve those that come to us. We're all about education. So we're listening to, nutritional education, physical education on how to help them to make better choices for themselves. what I do is I discuss with our patients about what I'm going to do for them, what's happening as I put my hands on their muscles, what I feel. And they even ask me questions. Well, what is that? Why do I feel so restricted? What's happening? So I enjoy with all my heart helping them to understand their own body, because they're in their own body. We exist in our body, and we know we have hands and feet and all these components, but sometimes when they're not operating correctly, we don't know why. And that's very frustrating. And so I enjoy discussing with the patients, okay, well, this is what I'm feeling. And how do you feel as I'm, applying pressure here, as we're moving and grooving here? And the feedback is what helps them to accelerate. They want to know more. They want to know, well, what else can I do? When I go home, how do I prolong this feeling of feeling like I'm standing up straight now? Like I feel more empowered. I didn't know my feet felt that way. I didn't know my arm felt that way. And I understand where they're coming from, because massage therapy was one of my avenues of healing when I went through a healing process. So it's just a wonderful tool to be able to reach out to the patients and allow them to know that this is another way that we support them. It's not just, okay, we're going to do this 1, 2, 3. No, it goes further than that. These are your muscles. This is how you can assist yourself. This is what we're going to do for you. And you can take it a step further and understand that you have the power to help these muscles become more pliable through nutrition, through exercise, through movement in any way, shape, or form. And you yourself can put your hand on yourself and feel like, what, that's kind of tight today. I think I can kind of touch that a little and massage that. And you don't need a license to touch your own arm. And I think that that's what's beautiful about what we do. We empower our patients, and that's important.
When you were saying that, and your approach, because I see that when you work on the patients, sometimes there are areas in the body that hurt. However, the human dynamics is that the body was designed with dualities, such as one muscle affects another. The tricep, pushes, the bicep disengages. There's a constant synergy with the muscular structure. Sometimes the pain or the discomfort in those areas are remote, or not even in the area where you had, you were actually initially told where the person's issues were. Tell us a little bit, Amparo, that how you kind of track down the discomfort in, let's say, an area of a problem that you've treated in the past.
One of the most common areas that I feel, or I've experienced with a lot of the patients, is when they discuss low back pain, or sometimes even sciatic pain. And they tell me, it's really restricting me from sitting up straight. It's restricting me from just being able to go in the grocery store and walk to and from, and not have to just feel like I need to sit. And so, okay, I understand. And then they get on the table. And as I'm working on their back, as I'm listening to what they're saying, I also marry together what my hands are saying. And basically, my hands are just interpreting what their muscles are saying. Because sometimes, for example, we can say something, and in and of ourselves, okay, I feel this pain right here. However, the muscle is saying, well, something else is happening, and it's extending. So they'll tell me my pain is in the low back. Well, I follow the connection from that low back. And as I'm feeling alongside the side of their leg, I feel how tight it is. And it's like, that's got to be very restrictive, all the way down to the knee. And I'm like, okay, so let's release that. And as I'm working on that, it's very powerful to hear the patient say, wow, I can feel that, but you're on my knee. And I'm like, it all goes together, because the knee attachments go straight into the low back, go into the hip area. And what's beautiful is that when they love to learn, everybody loves to learn about themselves. Why wouldn't you want to learn about yourself? It helps you become a better you. And so when I love to explain that to them, and they're like, wow, so if I do this, then I can feel better doing this. Absolutely. Ma'am, sir, right in here. Right in here is where I'm touching, I'm massaging, I'm applying compressions. It's very simple. In fact, it's even over your clothes. I'm just applying some pressure right there, gently releasing. And they're like, wow, the movement is a lot better. And it's interesting that just right around the knee, in the back, in the front even, and it helps to release that low back pain.
You mentioned these, like the referral pain patterns. It's incredible how the body adapts. We're like that gecko where, the foot's on the hot, it lifts the leg up and it throws off on a different leg. That's how the human body works. So if you have a low back problem, it will affect the mid back. It will affect your knees. The knees and low back are directly and indirectly related. So as we look at those dynamic changes, one of the things we actually look at is we track down the problem. Okay, it's not just so easy to just treat a low back problem for what it is. We have to find out the problem per every person, and every person's is their own design, and we can track it down pretty quickly. After a couple of minutes of working your body, we kind of got the suspect and it's not so apparent many times that it's just a low back problem. You mentioned sciatica. Sciatica is one of these things where it really isn't a disorder. It's a group of syndrome disorders that creates a lot of drama, and it almost has its own mind. It's like you got stress, well, sciatica flares up. You get upset about financial worries, sciatica flares up. It's like it sits there looming and it bites you, and it causes a whole disarray of problems and actually incapacitates a lot of people. Yes, we don't want to do surgically, and sometimes there are issues where it does require surgical intervention. We have diagnostic procedures that we do to determine the difference. There's over 1,000 reasons, and I would venture to say there's even more than 1,000 reasons of causing sciatica. So we got to get to the root cause of it. And does nutrition play? Yes. Will exercise play? Yes. We have to look at all these components. Now we have another individual here it's Faith Arciniega, right? As I said it right?
Yes.
Okay,
Perfect.
Arciniega. Okay, this is speech pathology 1 for me, 101. So Faith comes to us with a lot of a great experience. She's going to be an incredible doctor, nurse practitioner. That's the goal. Right now, she's in that process of going through that, but she also does our health coach integration. So she does a lot of different things from, body compositions, as Ana did mention, to weight, to laboratory tests, and acts as our integrator with Ana. So we facilitate the ability to communicate the issues and treat the problems and come up with a care plan that's appropriate. So Faith, tell us a little bit about what you do here in this particular group of people.
Right, absolutely. So like Dr. mentioned, my name is Faith Arciniega. I bridge the gap between Ana and Adriana and Amparo, and we all work very closely together to ensure the patients leave here with a better understanding of how their bodies should operate and should work. So if the doctor goes in and finds out they're having issues with their sciatica, I will go in before that, gather together their medical history, see what's going on, see if they have issues with the gut, depression, anxiety, and then I would then communicate with Ana about those issues, and we can work together to find supplements or what the correct diet is for them. So I work together with Ana and Adriana on that to ensure that the patient leaves healthier and with a better understanding of their body, because just like a car wouldn't operate correctly if we fill it with water, the human body isn't going to operate correctly if we don't fuel it correctly. So we teach them how they should eat, what supplements they should take, and how they should exercise so that they're moving and operating as they should be and as the body was created to.
As you kind of work with patients, literally right before we had this little unified meeting together, what we did notice is that we had a patient that had, chronic inflammation and pain everywhere. And it's crazy, but the problem comes as a low back problem and led to ankle issues. But we could clearly see that there was a dietary issue, and it was almost like inflammation happens, no injury, just keeps on inflaming. Then we find out that there's a lot of sugar, a lot of processed foods, a lot of meats. Well, to say that those are bad, it's not just that easy. But we have to figure out the cause for that particular individual. We assess food sensitivities. We do laboratory diagnostics. We figure out what it is, the root cause. Not everything is a surgical. As a matter of fact, most things are non-surgical. So what we try to do is allow the intelligence of the body, once it's figured out, using the knowledge that we have and the expertise that we have in functional wellness and functional nutrition, to be able to come up with a treatment plan that's appropriate with the exercise and the protocols that we use. So we have a lot going on here. So we wanted to do this as a beginning because we're going to be doing quite a few different presentations. But as we do changes, we hadn't been communicating a while. So now what we're going to be doing is we're going to be coming back at different presentations discussing particular topics. If you have a particular topic that you want us to to discuss, particularly about an injury, inflammation, and a disorder that falls into the world of functional wellness and even functional medicine. We correlate, associate, and look for causations that are related to the musculoskeletal system. So what we want to do is we want to be able to assess and determine what the true cause is, because once we fix you, we want to fix you right. We want to give you the tools that you can go on and you can live a great life, okay? Because everyone here knows that I tout it as much as possible. And man, if we're designed to live 100 years and probably more, according to even the statisticians out there, if you take care of everything, the heart will continue to pump years after it's removed from the body. So our body, if it doesn't get clogged with some atherosclerotic plaques or inflammatory disorders or some sort of diseases or cancers, if we can keep it healthy, we will live a good life. God willing. God willing. God wants you, he'll take you now. Okay. So we all know that. So the focus of today was to present a little bit of a review. So Ana, thank you very much for helping us out. You know, a little bit of information there. You know, Faith, you're out there, you got the cool soothing voice, and she's really cool from the voice there. You got Amparo, which is our therapist that finds and tracks down. We got to, you know, everyone here, we have many massage therapists that track down the issues. She's just the one that really has been able to formulate the ability to communicate the intention of the human body, which is, and also the results. And that takes years to do. You can't just go ahead and just present yourself. Doctors around the world will tell you a doctor that graduates, whether it's in any clinical practice, on his first day is not the same doctor 10 years later. And they're like wine, they get better each time. And most of the time, you'll find that doctors, the wiser they become, the more they rely on the wisdom of the body to be able to manipulate and facilitate the healing process. So for Adriana, she does our exercise, and she'll have you dancing and doing the Zumba and seeing, you know, what's best for you. And by the way, if you feel ugly that day, you can put the screen off. So you don't have to be showing your body. You just know that she's there, and you just tell her you're doing the exercises. But pretty funny. Someone probably had the video off, and they're probably sitting there just, you know, eating a bonbon or something. Yeah, I'm exercising. But we do have tools for that, like a cardio thing. They'll tell us what your heart rate's at. And if you're fibbing, we'll know too. But it doesn't happen anyway. But anyway, it was a great little connect today. It was the first. We look forward to more. Thank you guys. Thank you very much. Anyone have anything else to say? Faith, anything good? Anything you want to add?
No, just super excited for you all to come in here so that we can work together to find the best treatment plan for you. We're all very passionate about patient care, and we're excited to work with you.
All right.
Absolutely.
And Amparo?
We're just, like she said, we're ready to help you be empowered. Understand that you are the boss of you.
I'm the boss of me. I tell my wife that all the time. You know what she says? You think you're the boss of you, right? And I'm like, I have it. Oh, anyway. And Ana, anything you have to say?
We're so excited to work with all our patients, and we try to follow through and to listen to all the symptoms that you're having. So I guess that from our part, you will always have ears to follow through. So I'm
Awesome.
so excited being here.
Thank you so much. And Adriana, anything?
Well, we are here waiting for all of you, and we have a great team, all very passionate, as you see. And we are just here waiting for you to come in, and we are going to help you resolve.
We're going to
all
tear it
this.
up, guys. We're going to tear it up. We're going to make it. We're going to happen. Okay. So
Yes.
this is called Cobra Kai Chiropractic Center. Okay. So we'll tell you what, if you think you're going to come in here and just have a little talk, we're going to get it on. We're going to get it on with your body, and we're going to take it to the next level. And yeah, we got pythons around. Okay. We're going to make the body, we're going to make that body what it should be. Okay. And we're going to release it without in pain, and it's going to be a very comfortable dynamic. So thank you guys, and we look forward to being we'll connect to the next one. So God bless you guys. Have a good one.
Thank you.
Thank you.